Hey, welcome back to Evolution. This is Dr. Thurman. I'm going to talk a little bit about some techniques using foam roller and lacrosse ball, or these pink, soft pinky balls. You can use racket balls. These are sort of smash or compression type techniques that we're going to use on trigger points or fascia, areas that have gotten sort of stuck together, maybe with the term laminated together, like you have, skin, fat, fascia, muscle, ligament, tendon. When groups of those tissues get stuck together from recurrent postural strain or from, sitting too long on a bus or an airplane or in the car or at your office, these tissues can get compressed and then they just don't glide and slide as easily as they should. So one of the techniques that I use, and I've talked about it in my other video, is using a foam roller. And there are thousands of videos on how to use a foam roller. I'm not going to get into that deep, but simply, if we were going to use the foam roller on my right butt cheek, say, and my right lower lumbar spine or my right lower back, I would set the foam roller here, and I would start to use it as a massage tool or as a smashing tool to sort of get into those areas. We're moving lymph, we're moving blood, we're getting those tissues to sort of compress and release and trying to delaminate those structures so they move better and they hurt less and they create better function and better stability overall. Now, I use the foam roller first typically, so in this case I'd be using it here, and then I would come down here and I might get into those muscles down in my lower back. Now you'll notice I'm using just this real simple soft foam roller. This one happens to have two pieces. I don't use the smaller part that often, so it's not necessary. This is a $15 foam roller from Walmart, nothing fancy. You can spend $60 on a rumble roller and all kinds of different fancy rollers. That's okay. But for the purposes that I'm talking about here, I like to start with just a simple, relatively soft foam roller. Not as soft as like a noodle that your kids use in the pool, but not a super hard one to begin with. It's fine to have those in your arsenal. So after you've used this for, 30 seconds or a minute on these tissues here, then you take, I'm going to use the lacrosse ball right now. I like to get down here like this with my this figure 4 position, and then take the ball and slide it there, and then I can sort of roll into it on the upper part of my the butt cheek region, or I can come here like this, and same thing, I can really open up those tissues. Now what I'm doing is I'm going to get on those spots that are tender, 3 to 5 seconds, that's it, get off. Get in there, ow, 3 to 5 seconds, get off, move to the next one, and then be done with it. Don't hang out there for a long time and beat yourself up for 10 minutes. You're going to get black and blue, you're going to get sore, and you actually may create more problems. Now the other is on my lower back. I'm going to get that same position again. I'm going to slide this back here, and I'm going to just roll back over. Now you can see I'm using my hands to keep myself from totally leaning hard on the ball, but I am bringing down some pretty good weight. So again, I can find those tender spots and press in there for 3 to 5 seconds, get off, move it around. If I needed to work on my shoulder here, I would take the ball, roll it up underneath there, take my arm, pull out of here a little bit so I'm moving the shoulder blade away from the spine and exposing those muscles in there, and I can start hitting them again here. So again, 3 to 5 seconds per spot. That's all you need to do. Hit those spots that are tender, get in, get out, do it once or twice a day. That's going to be the ticket for cleaning up these areas. So along with the care that I do in the office, this at home is going to really free those things up, and it's going to keep the ball rolling, no pun intended, so that as I'm doing these larger interventions in the office with the manipulation and the percussion and all the things that I do here, we're having you do at home, keeping those tissues sliding and gliding, getting the blood to flow into them, getting the lymph to move around, getting rid of that inflammation, and you're going to get better a lot faster, and you're going to feel better. And then you have these tools to use on your own when you don't, when you're not in the office, or when doing on a daily basis, so you don't need to be here as much. All right, that's it for the smash techniques. Have a good one. Give me a call if you have any questions.